Hello, everyone. I'm Annalee Coakley. I'm a family physician in Calgary. I'm also a researcher at the University of Calgary and co-director of Refugee Health YYC, which is a research and education platform at the O'Brien Institute at the Cumming School of Medicine at the University of Calgary. And I was asked to present on the Canadian healthcare system and, in particular, healthcare access and coverage for international students. I'd first like to acknowledge that Canada is home of the traditional territories of Indigenous peoples. Like many, I work in the world of with refugees arriving in Canada, and similar to refugees, our Indigenous peoples have suffered from attempted cultural genocide. And so I'd like to acknowledge that we are living on their territories and that we're very grateful to live, learn, and share knowledge on these lands. And so first, I'd just like to talk very broadly about the Canadian healthcare system because it is quite confusing. Migration to Canada is a federal jurisdiction, whereas healthcare is a provincial jurisdiction, and those two levels of government do not coordinate. And so if you're wondering why it's confusing for you, this is a large part of the reason why. Canada is not strictly one health system. It's not one unified health system. It's actually 13 smaller health systems that are operated by the provincial governments. And for you in particular, as international students, it's very confusing because each province provides access to healthcare for international students very differently. And so this is why for most of you, there will be a gap in healthcare coverage, which is why private health insurance to cover yourself during that gap is very important. And then each university, for both Canadians and international students, each university provides a student plan to provide supplemental health benefits. And so we'll talk about that. Again, so in general, across Canada, we have a almost universal publicly funded healthcare system. And in general, what the province covers is not everything. It covers essential health services, and it covers what the province deems as essential health services. And so this will be things like access to a doctor, to acute care, to investigations. So under your publicly funded provincial healthcare insurance plan, so you'll have a card, a provincial healthcare card. So that would cover doctor's visits if you ever needed hospital admission, if you needed an x-ray or a lab test. That is what the publicly funded system covers. So as you can tell, it doesn't cover everything. There are large gaps. And so it doesn't cover any service that isn't deemed by the province to be essential. You might find it essential, but if it's not medically necessary, the province doesn't cover it. So examples of this might be if you had a baby in Canada, circumcision is not covered because it's not considered a medically essential service. Any Any sort of cosmetic procedures, those are not deemed medically essential, so those aren't covered. Filling out forms. So if you go to a doctor to have a form filled out, those are not covered by the publicly funded system, and your doctor will ask you to pay money for the completion of the form. Other things that might surprise you that are not covered are things like ambulance services. So if you were to call 911, and you have an ambulance that is dispatched and they come and see you and take you to hospital, you will receive a bill in the mail. So that is not considered an essential service, which is surprising for a lot of us, I know. Other things that are not covered are drugs. So your medications are not covered under this system. Nor is dental, even though you might think dental is essential. It's an essential service. It has a profound impact on your overall health, but this is not covered in Canada under the provincial healthcare system. Optometry. So if you are having a visual acuity assessment, so going to the eye doctor to have your vision checked, getting glasses, that is not covered. And so just to understand, those services are not covered. Other things too that aren't covered would be things like physiotherapy. A physiotherapist, massage therapist, occupational therapist, all of those are considered outside of the publicly funded system. And so this is why at universities and at places of employment, people are offered private health insurance packages, and those private insurance packages are to cover those services that are not covered in the publicly funded system. So you'll notice that your school offers a student plan. And for most schools, you're opted in automatically to this student plan. And this student plan covers what the publicly funded system does not cover. So this would be your medications, optical services, dental services. It'll cover ambulance services if you call an ambulance, physio, massage, etc. And so generally, it's a very good idea to enroll in a student plan that covers these supplementary benefits. In Canada, most people will buy a plan either as a private individual or many employers. If you work, for example, if you work for Alberta Health Services in Alberta, they would provide a private plan as well that covers things that are not covered by the publicly funded system, because those additional services are essential and they're quite expensive. Oftentimes a prescription can be anywhere from $50 to $300 depending on the prescription. And so to have a health insurance plan that covers medications is often essential for people. In addition, if you were to see a dentist often costs for a basic assessment, it's over $100. If they do anything like a cleaning, or if you need cavities filled, any little thing with the dentist is extremely expensive, and so often can run you hundreds, if not thousands of dollars. So again, a private plan is a great idea. For visual assessments with an optometrist, seeing, having the private plan that covers visual acuity assessments and glasses is also a very good idea. To see an optometrist, it's often $100 to $150. Glasses cost, at minimum, it's $200. Of course, if you want fancier glasses, maybe designer glasses, it can sometimes be $800, $900, $1,000, so incredibly expensive. And of course, one ambulance trip is it's usually around $700. And so if ever you were in a health crisis, it's so nice to have the supplementary benefits through your student plan to give you peace of mind. It's honestly cheaper to buy the private plan or to enroll in your student plan rather than having to pay the costs upfront out of pocket. The other thing to think about is in each province, international students, because international students are temporary residents and not permanent residents of Canada, there's a lot of variability in terms of access to the publicly funded plan. So, and oftentimes, at minimum, there's oftentimes a waiting period. So, for example, I work also in Nova Scotia. There is a 3-month waiting period. In many other provinces, it's 3 months or 6-month waiting period prior to you becoming eligible to apply for the health insurance plan that's publicly funded. And so having private health insurance to cover you during the waiting period is also a very good idea, because it really would just take one acute illness, one car accident that required hospital admission, and then you would be, devastated financially if you ever required hospital admission, which would run into the thousands and thousands of dollars. And so to purchase a private plan to cover you while you're waiting to become eligible for the publicly funded plan is a very good idea, and it'll just give you peace of mind, and it will prevent financial devastation in case of an acute illness or an accident that requires you to be admitted to hospital, which is incredibly expensive in Canada. And so, some common misconceptions that are out there. Canada is known to have this universal publicly funded system, and so people have this impression that everything is free. And that's simply not the case. It does have a relatively universal system, but it does exclude temporary residents of Canada or undocumented people, so it's not wholly universal. And not everything is covered. So just be aware, it only covers things that the government deems essential and nothing else. And even though an ambulance, one would think, oh, it's essential. Yes, I would agree with that. But the government charges people for using the ambulance service. So, and the cost of that is usually around $700. So just be mindful of that. So our system doesn't cover everything and excludes prescription drugs, dental, vision, and ambulance. Finding a family doctor is incredibly challenging nowadays. So there's an acute, there's a crisis in healthcare at the moment, and in particular with primary care. the healthcare system in Canada has been under strain for a very long time. But I would say that since the pandemic, it's in crisis. And so it's incredibly difficult to find a family doctor. If you are an international student, though, the benefit of being a student is that most universities have a clinic for students that is associated with the university. So that would be your first stop. If you're trying to find ongoing primary care, it would be with the university provided health services. Usually it's on campus, and so just reach out to your student advisor and find out, or student affairs, and find out where it is and how to contact them to book appointments. In the community, it's incredibly difficult. If you just Google, usually most provinces will have a central registry. So once you're enrolled in the publicly funded health insurance scheme, so you have your provincial health care card, then you can once you have your healthcare card, then you can Google, how do I find a family doctor in Alberta, for example. And then it should give you a number to call or an email address or a link, and you can go in there and put your name on a list for a family doctor. Of course, it's in some places it's hundreds of thousands of people along that list, but every once in a while, depending on where you're living, family doctors become available, and then you'll be connected and attached to a family doctor that way. The other issue is because most family doctors and the student services clinic, those are appointment based. So you'd have to book an appointment. And sometimes those appointments can be a bit far out in the future. If you have a more pressing health concern and you need to see somebody quickly, and it's not an emergency. So if it's something where you need to see somebody sooner rather than later, but it's not a health emergency where you need to go to the emergency department, then in most jurisdictions across Canada, there's something called walk-in clinics. And again, you can just Google walk-in clinics near me, and it'll show you the walk-in clinics near you. And then those clinics they're not appointment based. So it's first come, first serve. So almost like an emergency department where you'll go in, you'll register, and then you'll wait to be seen. You'll just wait your turn. So those are great for sort of more urgent concerns that can't wait for an appointment a week from now, 2 weeks from now with your family doctor or with the student health clinic. The other option for some people in some jurisdictions would be the pharmacist. So in Canada, many pharmacists are prescribing pharmacists. This means that they can help you deal with certain very simple issues, so if you had a sore throat and you were worried about strep throat, you can go see a prescribing pharmacist. They'll do a swab and they can treat you with antibiotics without you having to go see a doctor. Or if you had a bladder infection where you're having problems peeing, where it's hurting when you pee and you're peeing small amounts frequently, you can go to see your pharmacist about that, and they can prescribe you an antibiotic for bladder infections. So walk-in clinics, the pharmacist, those are good options for more urgent concerns that can't wait for an appointment with your family physician. And then if you have a an emergent issue. So let's say suddenly you can't breathe, you're having problems breathing, you're having severe excruciating pain, then you need the emergency department. So then you go right to the emergency department. So the emergency department is for emergencies. So it's not for filling out forms, it's not for a cold or, a run-of-the-mill sort of symptoms. It's for emergencies like crushing chest pain, severe abdominal pain, you cannot breathe. That's what the emergency department is for. And then you can just go to your closest emergency department. You can go either in your own vehicle or in in a taxi, etc. Or if it's very, very emergent, you can call 911 and they'll take you to the emergency department. Another issue is around annual checkups. So, annual checkups are actually a bit controversial, except for screening tests for certain diseases. The annual checkup, if you're feeling totally fine, the annual checkup doesn't really add a whole lot to your health. If you meet eligibility criteria, so let's say you're a woman, age 26 and up, then having routine, regular pap smears to check for cervical cancer, that is a good idea. If you are older, like for example, if you're in your 40s or 50s, having regular mammograms to screen for breast cancer is a good idea. If you're older, like over the age of 50, having tests to screen for colon cancer are a good idea. Or if you're sort of middle-aged, being screened for hypertension, so high blood pressure and diabetes, that's also a good idea. But generally, if you're feeling really well, like having a checkup is not, generally it doesn't really find things that that are of any significant concern. And if you're an international student, I'm assuming you're young. And so really the only test that's really necessary when you're otherwise feeling well would be the pap smear, which is the screening test for cervical cancer in women over the age of 26. And again, the eligibility criteria for pap smears and other screening tests for diabetes and cancer, there's always a little bit of variation province to province. And so, again, we already talked about this, but you need to sort of coordinate your coverage between the publicly funded provincial plan, which covers essential health services, your student plan, which will cover additional supplementary benefits like medication, optometry, dental, ambulance, massage and physio. And then you need a private health insurance plan to cover you while you're waiting to become eligible for the publicly funded health plan in the province that you're living. And so we're just going to talk a little bit about a few provinces, like where students commonly live, and we'll just look at some of the differences between the provinces. So with Alberta, which is where I'm from, if you are an international student on a visa that's for 12 months or more, then you are immediately eligible for the publicly funded health insurance. So as soon as you arrive in Alberta, you need to be applying for that. And then you apply, and then you'll get your healthcare card. And it's this card that you take with you to any appointment that you have with a doctor, with the lab, with the x-ray department. If you're getting vaccines with public health, that card is what allows your doctor it tells your doctor to bill the provincial government instead of billing you. So as soon as you land, you need to apply for the provincial health plan. And again, this covers doctor's visits, hospital admissions, emergency department visits, but it does not cover medications, dental, vision, ambulance, physiotherapy, massage therapy. And so time is of the essence. So enroll as soon as you land in Alberta. And you really should apply within the first 90 days. But I would say within your first week of arriving in Alberta, you should apply for the provincial plan. You'll need to bring your study permit, your proof of your address, your photo ID, etc. And there's no waiting period in Alberta. So as soon as you get that provincial healthcare card, and you're eligible immediately upon arriving in Alberta, apply for it, you'll get it right away, and then you have peace of mind. And then the universities also provide supplemental benefits through their student plans. So this is things that cover, medication, optometry, dental. So enroll in those programs as soon as you can. It's well worth it. And then for British Columbia is a little bit different. So, there's a 6 months. So anyone staying for 6 months or more, they're eligible for the provincial plan, but international students will be charged $75 a month. And this will cover physician visits, hospital visits and admissions, emergency department visits, but it doesn't include medication, optometry, dental, or ambulance. And so this you can apply immediately after your arrival. Your coverage would start 3 months after your arrival. In the meantime, while you're waiting for that coverage, it's a good idea to have a private plan while you're waiting for the provincial plan to start. And again, most institutions have a student plan that also covers the supplementary services like optometry, dental, medication, physio, massage, etc. And similarly in Saskatchewan, international students are covered if they're studying in Saskatchewan for 6 or more months. And again, this just covers essential physician services, hospital visits, emergency department visits, labs, diagnostic imaging, but it doesn't include medication, dental, vision, physio, massage, etc. And again, you apply for this immediately after your arrival. And if there's any waiting period, just make sure you have private insurance to cover you for that waiting period. And so Manitoba is a little more similar to Alberta in that the provincial plan covers international students right away. And again, like all provincial plans, it covers essential health services, so physician visits, hospital visits, but it doesn't include the optometry, dental, medication, etc. And so you would apply for the provincial plan as soon as you can, immediately upon arrival. If you think there's going to be any gap in your coverage, then please obtain a private plan to cover you during that gap. And of course, the student plans are great for covering all of the supplementary benefits. Now, Ontario is a bit different, so it does not provide OHIP, which is their provincial health insurance, to most international students. And the universities require international students to enroll in UHIP. And so this will cover the core medical services. And so students are enrolled in UHIP via their institution upon registration. It also includes extended health benefits for medication, dental, vision. And then UHIP also covers like the essential health services like doctor's visits, hospital visits or admissions, emerge visits, ambulance, etc. And this has to be renewed alongside your study permit. And Quebec, if you're in university in Quebec, the public plan is called RAMQ, and it covers some international students via some reciprocity agreements. Others require private university-administered plans, and then the student plans with the universities cover the extras. And so Quebec is always doing things its own way. It's our French province here in Canada, and it's very closely aligned with French countries. So, some students from French countries are eligible for RAMQ, the provincial health insurance, immediately after their arrival. But if you're not from one of those countries where Quebec has an agreement of reciprocity, then you will need a private plan and, of course, the student plan for supplementary benefits. And then for Nova Scotia, there's a bit of a waiting period. And so the waiting period is often a year. And so students need a private plan initially. And then, of course, at the schools, at the universities, the student plans cover supplementary benefits, so medications, vision, dental, massage, physiotherapy. But you will need to purchase a private plan to cover essential health services like doctor's visits, hospital visits and admissions, emergency department visits. That's what you need to purchase privately while you're waiting to become eligible for the publicly funded provincial system, which happens after a year. And again, there's different private plans that you could use while you're waiting to become eligible for the provincial plan. And in New Brunswick Medicare, it covers many international students, but there is a waiting period. And so again, you will need a private plan to cover you during that waiting period. And then you will enroll in the student plan provided by your university to cover the supplementary package, which would be, dental, vision, medications. And again, like PEI, so it's one of our smallest provinces. Some international students would be eligible for the provincial plan, but there will be a waiting period. And those international students who are eligible, it will depend on the program length and the length of time that you're studying in PEI. And then, of course, get the student plan for all the extra supplementary benefits. Okay, and Newfoundland. So again, if you are studying in Newfoundland, Newfoundland provides access to the publicly funded system if you have a study permit for 12 or more months, and then enroll in the student plan for the supplementary benefits. And again, in the Canadian North, there's a territory called the Yukon. There's very limited publicly funded access, and so your institution will require that you have a private plan. And the same with the Northwest Territories, if you are studying there. I don't know if too many of you would be studying in the Canadian North. Basically, the take home is this, is that for most provinces, there will be a gap while you're waiting to be eligible for the provincial plan. You will need a private plan to cover essential health services like doctor's visits, hospital admissions, ER visits, while you're waiting to become eligible for the publicly funded plan. Everyone in Canada also enrolls in the student plan, because the student plan provides you coverage for medication, optometry services, dental services, physiotherapy, massage therapy. And those are very expensive services in Canada. And so it's usually very cost effective to enroll in the student plan, so that you have coverage for those supplementary health services that aren't covered by the publicly funded health insurance. And always, when you visit a doctor, or a hospital, you're always going to need to show them your healthcare card and a photo ID. Sometimes the photo ID is your healthcare card. In other places, your healthcare card doesn't have your photo, and so always bring a photo ID. And so I hope that this was helpful. Please send me any sort of questions, or if there was